I'm Kaye, Deputy Director for the Office of HIV/AIDS Infectious Disease Policy at the Health Department, Health and Human Services. And I'm delighted to be here with Antigone Dempsey with our HRSA Hab. This is our first day reporting live, Facebook Live with our HIV.gov here at the USCA conference. It's the 22nd annual conference and we're here to fight HIV. So Antigone, so glad you're here joining us with our Facebook Live session. And you guys are super busy at this session, and I want to hear a little bit more about what's going on with HRSA Hab and what's happening here.
Thanks, Kaye, and I'm very excited to be able to join you on your launch for the conference, talking about also the work that HIV.gov is going to be doing here at the conference. So we're here, we're going to be talking about data utilization. As you know, in the Ryan White HIV/AIDS program, data is a really critical piece of the work that we do, and looking at data and how do our recipients and the folks on the ground use data to be able to inform what they're doing. We're also going to be talking about a number of our technical assistance programs where we provide technical assistance to folks on the ground around how do they use evidence-informed interventions, how are they using promising practices, and then also we're going to be talking and providing technical assistance on how we support our Ryan White HIV/AIDS program Part A planning councils as well.
Okay.
And then another thing that we're going to be talking about is looking at the opioid epidemic, the opioid crisis, as we all know. It's a huge crisis right now, and it's really important that we're all working to end that. And at HRSA, we really prioritize that. So we're going to be talking about the impact of the opioid crisis on the Ryan White HIV/AIDS program. What are we doing? What can we do? How can we support our providers in helping support people, who are struggling with this? So, yeah.
Now, something you said, Antigone, that it made me think. CDC is doing a lot here at this session conference about data utilization. Can you tell me just a little bit more specifically about what HRSA Hab is doing in some of the sessions?
Yeah, that's a great question. So, something that we have found that's very important is, so first of all, just sort of to set the stage, in the Ryan White program, all of our recipients submit client-level data to us. So we receive data on over 500,000 people living with HIV that the Ryan White program serves. And we also get information about viral suppression. And so in the past couple of years, we've been releasing a report annually, that really shares, who are we serving, how are they doing, where are they located, and one of the big things is looking at viral suppression. And we've seen that our last data in 2016 showed that we were close to 85% virally suppressed for the folks who receive medical care through our program. And so one of the things we've looked at is also beyond just looking at the big picture, how it's really important to utilize that data and dive down and look at specific populations. So when we do that, and we think it's very useful to do it on a clinic level or a community level or just jurisdiction level, because what we found is that we see the folks that are, even though we're doing great, we still have disparities. So young people is a population where there's a huge disparity in terms of being able to reach viral suppression. Transgender women is another population that we're also seeing disparities. And also, when you look at all of our data, if people are homeless or experiencing homelessness, their viral suppression rates are not, where they need to be. So, that's one of the things that we want to help talk to people about, be able to share how we've done that so that they can learn, how they can look at their own data and target, where they need to target to sort of address those disparities.
And I think it's important to note that when you talk about data utilization, there's a consistent theme. Talking about from the summer and PEPFAR and what was happening there and here at the USCA. So I'm really excited to hear that these are all things that we talked about at the conference. Another issue I think that's critically important, we talk about treatment as prevention. And, we can hear our colleagues now, and they're getting revved up for the next session. Talk to me a little bit about treatment as prevention and what HRSA Hab has been doing in that realm.
Yeah, so thank you for that. Actually, we've had a great experience working with your office, the Office of HIV/AIDS and Infectious Disease Policy, on a work group with the CDC and NIH and SAMHSA, and HRSA as a key partner in that work group to look at the viral suppression messaging. And this started about a year or so ago. We wanted to have standardized messages so that we were all on the same page as federal agencies. We didn't confuse anybody. And so that was a great process, and I think, we've come up with some very good messaging. So, after Amsterdam, in the International AIDS Conference, I think that's even ramped up even more. And so at HRSA, what we're doing is first of all, we've already started to change our notice of funding awards to make sure that language is updated in those. And so that's one thing that we've done. We're working with our AIDS education and training centers. So my colleague Harold Phillips, who works at HRSA, is working with the AIDS education and training centers because they train providers. And one of the things that we've really realized in HRSA HIV/AIDS Bureau is that we're talking about multiple target audiences. So we're talking about the folks that we fund, what are they doing, thinking about this messaging, the providers who are directly providing medical care, or the case managers, or the person at the front desk. Really important to know those messages and be able to have the tools that they need to be able to talk with folks about this message and sexual health. And then also people living with HIV and how important we've been hearing over and over. And I think that the U equals U, movement that has been a community and continues to be a very strong community movement has really helped bring to the forefront the importance of this messaging for people living with HIV and the huge changes that it has on how people feel about themselves and the impact of it.
I think it's so important with the Office of HIV/AIDS and Infectious Disease Policy, working with that federal work group. I can't underscore how important it's been to come to sort of common ground on those messages. And that was a heavy lift.
Yes.
That was a heavy lift. Important and heavy lift. Heavy lift. So when we talk about treatment as prevention, would you care to share, if you're looking back of just sort of what HRSA HAB is doing, but what you bring, like in your dedication to your work and to your life, would you like to share?
So I was just thinking as I was talking, beyond just all these groups that I've been talking about, it's really impacted me personally. I've been living with HIV since 1990, and I have an 8-year-old, and, the messages have, really impacted how I talk about it, how I feel about myself. And, the other day we're in the car, and the medication I take, I have an alarm that it reminds me to take it. So that's my adherence thing.
Yes.
So he knows about the alarm, and he knows about the medication, and it was going off, and then he asked me, Mommy, why are you taking that medication?
And
I was like, well, because I have a virus in my body, and it treats that. And then he said, well, can I get that virus? And I was like, no, you can't get it. And then it hit me, and I said, you know what? I don't have a virus in my blood because I don't. It was just a profound moment. I said something that I've been saying for 25 years.
That's right.
And that's not true anymore. I don't have the virus in my blood.
That's right.
And I was just so grateful to him that he was asking me those questions and I could share that. And it happens every day. Something different happens and shifts. And so it's just a profound shift. And we want to help support that at HRSA's HIV/AIDS Bureau because, our mission is to serve and to help change the lives of people living with HIV, and the providers out there do that every day. And this is another huge piece to be able to do that. So we're excited to be here at the conference to help support the communities that are coming together, our federal partners. We love working with you all to be able to just all come together, because we really are in an important place in this epidemic. Where some major changes are happening. So I'm excited to be a part of that.
And I'm so happy you joined me today. I'm so happy our listeners are here joining us because as we walk in thy truth, as you hear that statement, it means so much more today. And so I really appreciate you sharing and spending this time with us. Later today, we'll be meeting with Dr. Eugene McCrae at CDC, Director of the HIV Bureau division there. And thank you for joining, and we look forward to seeing you later.
Thank you.
Thank you.